Hi, everybody. So, in today's sip of the day, I thought I will concentrate on tuberculosis because 2025, we want to eliminate tuberculosis from our country. And the whole country and the government is trying very hard to do this. In fact, from the 7th of December, we have launched something called the 100-day campaign for the elimination of tuberculosis. Just as we fought a war against polio, we fought a war against smallpox, we fought against COVID 19, we want to fight against tuberculosis as well and make sure this disease goes away from the world. And for this, it's not enough for the government, it's not enough for the doctors to work alone. It's important for each and every one of you to participate. And how can you participate is what I thought I would share in this SIP. Now, I told you it's a 100-day campaign, and it's a 100-day campaign that's going to end on the 24th of March, which is observed the world over as World TB Day. It was on this day that Dr. Robert Koch announced that Mycobacterium tuberculosis causes tuberculosis. We identified the bacilli that is causing tuberculosis. This was way back in 1882, and a number of things have happened since then. To date, tuberculosis can be cured. But if you see the difference, you just went to Australia virtually. In Australia, per year, we get around 1,300 cases of tuberculosis. But in our country, we get more than 2.5 million cases of tuberculosis, and 4 lakh people die of tuberculosis every year. Now, this is a shame because today we have a cure for tuberculosis. The treatment is available in all health centers free of cost. The complete treatment is available free of cost. Yet people do not come for the diagnosis, yet people do not complete the treatment, and therefore people die of tuberculosis. It's important for all of us to understand the signs of tuberculosis, to know that TB is curable, and inform other people. It's not enough that you know it yourself. You need to tell others that tuberculosis is curable, tuberculosis is treatable. We can treat tuberculosis. Just remember the word treat, and I'll try to explain to you what we need to remember. So T tells we need to treat everyone at risk. We need to test everybody at risk. Now, who are the people who are at risk? People who had tuberculosis in the past, people who have contact with people with tuberculosis, people who are immunocompromised, people with diabetes, maybe taking some chemotherapy. So these are people who are at risk of tuberculosis. People living who are in prisons, prisoners are at risk, higher risk of tuberculosis. Older people are at risk of tuberculosis because the immunity drops as we grow older, and therefore the tuberculosis bacilli, even if they got an infection long time ago, it can wake up as people grow older, and therefore tuberculosis can come up. So we need to know what are the signs of tuberculosis. That brings us to R, TR, recognize the signs of tuberculosis. And what are these signs? Cough, simple cough that all of us get. But if you have cough for more than 2 weeks, you should test yourself for tuberculosis. If you actually go to a doctor and you say, Doctor, I have cough for the last 2 weeks, the doctor would want to test for tuberculosis. If you have weight loss, cough by itself is enough for the doctor to do the test for tuberculosis. But if you have weight loss, if you have blood when you cough out, all these are signs of tuberculosis. If you have temperature, your temperature goes, especially what we call evening rise of temperature. It's very low temperature. Sanje maka baren disna, ang fotta she dista, zor ailya bashen dista, zor ya na pun zor ailya bashen. So low grade temperature towards the night time, evening rise of temperature. These could be signs of tuberculosis. This now we have very good tests. We do what is called a CBNet test for tuberculosis. But remember one thing, you have to give the expectorant when you're testing. Give the expectorant, not the spit. If you give the spit, you may not find the TB bacilli over there. You need to cough out and bring the inside out, the expectorant out, and that has to go for testing. 2 samples of your expectorant or sputum is taken for the test, and it very fast in 2 hours time you can make the diagnosis of tuberculosis. And you not only make the diagnosis of tuberculosis, you also know whether you are resistant or sensitive to the drugs that we commonly use for tuberculosis. So that is TR. E is eat well to build your immunity. It's very important. Now, with the TB program itself, the government is giving money to people such that they can buy food for themselves to build on the immunity. There are various other nutrition initiatives for tuberculosis to educate people what they need to eat to build their immunity such that they do not get tuberculosis. A lot of us in India are exposed to this bacillus. The bacillus is all over the place, but it's because of our good immunity we do not get tuberculosis disease. Because our immunity is good, we do not get the disease. We get infected, we do not get the disease. So we need to keep our immunity high. If the immunity drops, that is when TB can come. He also tells us we need to educate people all around. So people working in your house, your neighbors, people that you meet, just like that. Talk about tuberculosis. This is the 100-day campaign going on. All of you are part of this campaign. Educate other people and enlighten people to understand the signs of tuberculosis. Go to the health center, get themselves tested and treated in case they're having tuberculosis. A tells us about antibiotics. TREA. A is about antibiotics. We don't give just one antibiotic, and antibiotics for tuberculosis is not like the normal course of antibiotic taken for 5 days or 7 days. This is a long period that you have to take the treatment. Very fast after taking the treatment, that cough will go, person will start feeling better, your appetite will improve. Within 10 days or maybe in a month's time, the person will feel, okay, everything is gone and I'm cured of tuberculosis, and say, now why to take the treatment for so long? No, the treatment has to be taken as prescribed by the doctor. Minimum it is 6 months. So in the first 2 months, we give what is intensive phase, and then a continuous phase for 4 months. Have to take the treatment like that. So if you know someone who has been started on tuberculosis and then comes to you and say that yes, I took, but then after that I felt better, so I don't continue with the treatment. I don't think it's required, and it was causing some kind of problems for me. I don't want to take the treatment for so long. No, the person has to take the treatment for the whole course, or else tuberculosis will come back and will come resistant. And resistant forms of tuberculosis is very difficult to treat. So it's important that you take the full course. A is about antibiotics, or with just not one antibiotic. It's a combination of antibiotics that you would give people. Take it the way the doctor is telling you to take it. And T is tell the people to take the treatment completely. T is, again, I'm trying to emphasize, and so I've kept one alphabet only for this, to say T, take the treatment completely in tuberculosis. So TREAT, test everyone who is at risk, recognize the signs of tuberculosis, eat well to build up your immunity and educate people. Antibiotics have to be taken, and T tells us to take the whole treatment completely. That is the sip for the day. Fight and join this fight against tuberculosis. Together, we can eliminate tuberculosis. Thank you.